Welcome everyone to today's MCQ-based question and answer session. Each question will have multiple choice answers, and you'll have a limited time to choose the correct answer. Let's get started and see how much you know. Question 1. The bony landmark of the scapula that exists where the vertebral and axillary borders meet is the A. Superior angle, B. Inferior angle, C. Spinous process, D. Acromion process. Answer is B. Inferior angle. Question 2. Which of the following is not true about pronator teres muscle? A. It forms the medial boundary of cubital fossa. B. The ulnar artery passes between two heads. C. It arises from common flexor origin. D. It adducts the radius bone. Answer is B. The ulnar artery passes between two heads. Question 3. The nerve involved on the flexion of the elbow joint. A. Median nerve, B. Musculocutaneous, C. Radial nerve, D. Ulnar nerve. Answer is B. Musculocutaneous nerve. Question 4. Choose the false statement regarding anatomical snuff box. A. It lies between extensor pollicis longus and abductor pollicis longus. B. It has extensor pollicis longus on its ulnar side. C. It has the trapezoid palpable at its base. D. It is the most obvious with the thumb fully abducted. Answer is C. It has the trapezoid palpable at its base. Question 5. A 45-year-old male arrived at the emergency department with injuries to his left elbow after he fell in a bicycle race. Radiographic and MRI examinations show a fracture of the medial epicondyle and a torn ulnar nerve. Which of the following muscles would be most likely to be paralyzed? A. Flexor digitorum superficialis, B. Flexor carpi ulnaris, C. Biceps brachii, D. Brachioradialis. Right answer is B. Flexor carpi ulnaris. Question 6. The right shoulder of a 78-year-old female had become increasingly painful over the past year. Abduction of the right arm caused her to wince from the discomfort. Palpation of the deltoid muscle by the physician produced exquisite pain. Imaging studies reveal intermuscular inflammation extending over the head of the humerus. What structure was inflamed? A. Subscapular bursa, B. Subacromial bursa, C. Glenohumeral joint cavity, D. Infraspinatus muscle. Answer is B. Subacromial bursa. Question 7. The dorsal interossei muscles are innervated by A. The deep branch of the radial nerve, B. A deep branch of the ulnar nerve, C. Musculocutaneous, D. Recurrent branch of the median. Answer is B. Deep branch of the ulnar nerve. Question 8. Choose the false statement about peripheral nerve injury in upper limb. A. Radial nerve injury cause anesthesia over anatomical snuff box. B. Median nerve injury cause wrist drop. C. Ulnar nerve injury cause claw hand. D. Index finger anesthesia is caused by median nerve injury. Answer is B. Median nerve injury cause wrist drop. Question 9. Sensory supply of the tip of the ring finger is A. Radial and ulnar nerve, B. Median nerve, C. Median and ulnar nerve, D. Ulnar nerve. Answer is C. Median and ulnar nerve. Question 10. Choose the right statement with respect to the flexor retinaculum. A. The tendon of palmaris longus passes deep to it. B. The median nerve passes superficial to it. C. The ulnar artery passes deep to it. D. It attaches to the scaphoid, hamate, pisiform, and trapezium. Answer is D. It attaches to the scaphoid, hamate, pisiform, and trapezium. Question 11. The palmar interossei and third, fourth lumbricals muscles are innervated by the A. Deep branch of the ulnar nerve. B. Deep branch of the radial nerve. C. Musculocutaneous nerve. D. Recurrent branch of the median nerve. Answer is A. Deep branch of the ulnar nerve. Question 12. Choose the true statement with regard to the anatomical snuff box. A. The basilic vein originates in it. B. The extensor pollicis longus tendon forms its ulnar border. C. The radial artery makes up part of its roof. D. The abductor pollicis brevis tendon forms its radial border. Answer is B. The extensor pollicis longus tendon forms its ulnar border. Question 13. True regarding tendons across the wrist joint. A. Flexor carpi ulnaris passes deep to the flexor retinaculum. B. Extensor carpi radialis brevis inserts into the base of the third metacarpal. C. Flexor digitorum profundus tendons insert into the base of the proximal phalanx. D. Extensor carpi radialis longus passes through carpal tunnel. Answer is B. Extensor carpi radialis brevis inserts into the base of the third metacarpal. Question 14. The lymph from the medial quadrants of the breast drain mainly into the A. Posterior axillary, subscapular nodes. B. Internal thoracic nodes. C. Anterior axillary, pectoral nodes. D. Lateral axillary, brachial nodes. E. Infraclavicular, deltopectoral nodes. Answer is B. Internal thoracic nodes. Question 15. The synovial sheath of the flexor pollicis longus muscle forms the A. Thenar space. B. Radial bursa of the wrist. C. Ulnar bursa of the wrist. D. Digital synovial sheath for the index finger. Answer is B. Radial bursa of the wrist. Question 16. The following part or branch of the brachial plexus has a terminal branch that supplies the skin on the medial side of the arm. A. Musculocutaneous nerve. B. Lateral cord. C. Thoracodorsal nerve. D. Medial cord. Answer is D. Medial cord. Question 17. The quadrangular space in the region of the shoulder transmits the following structures except which? A. The axillary nerve. B. The posterior circumflex humeral artery. C. The lymphatic vessels. D. The radial nerve. Answer is D. The radial nerve. Question 18. The surgical neck of the humerus is related to the A. Radial nerve. B. Axillary nerve. C. Ulnar nerve. D. Median nerve. Answer is B. Axillary nerve. Question 19. Choose the true statement regarding the axilla. A. Has its floor composed of serratus anterior down to fourth rib. B. Has the clavipectoral fascia as part of the anterior wall. C. Receives lymphatics from the arm only. D. Has teres minor as part of the posterior wall. Answer is B. Has the clavipectoral fascia as part of the anterior wall. Question 20. Which of the following is a branch of the posterior cord of the brachial plexus? A. Dorsal scapular nerve. B. Long thoracic nerve. C. Musculocutaneous nerve. D. Thoracodorsal nerve. Answer is D. Thoracodorsal.